Hello guys, welcome back to my channel. So today we will be covering digestive and gastrointestinal treatment modalities. Before I begin, remember to subscribe, like, share, and if you have any questions, you can leave it down in the comment below. So let's get started. So what is the purpose of gastrointestinal intubation? So some reasons for this is decompression of the stomach. This may be done to initiate bowel rest. We can also do lavage of the stomach, aka emptying out the contents in the stomach. It can be used to diagnose GI disorders, administer medication and feeding, to compress a bleeding site. For example, a gastric ulcer. If that fluid is sitting in the stomach and it is irritating that area, then healing will not occur as easily. So we would have to empty the stomach in order to initiate rest for the GI system and also to promote healing. We can also aspirate gastric secretion to do analysis. This includes you can do a pH test to see the acidity of the stomach, and you can also do it to see how well the stomach is emptying. Alright, so let's move on to enteral feeding. We know that enteral feeding is via tube to the digestive tract or to the GI tract. Alright, so some advantages of enteral feeding include meets the nutritional requirements when oral intake is inadequate or not possible. This means that the patient may be having difficulty swallowing or they are intubated. If they're intubated, you know they're not going to be eating. So they have to initiate an enteral feed in order to maintain this person's nutritional status. So some advantages: it is safe and cost effective. It preserves the GI integrity. Think about it. If you are not keeping the system active, it will stop working eventually. So if you don't use it, you lose it. So you definitely have to make sure you continue with the enteral feed in order to maintain the optimal function of the gastrointestinal tract. Enteral feeding also helps to maintain fat metabolism and lipoprotein synthesis. Again, because there's food being put into the system, then the function will continue. And also it helps to maintain normal insulin and glucagon ratios. So there are two enteral feeding methods. You can do it by the nasogastric route, and this is usually more temporary, and you can also do a gastrostomy. This is usually for long term. Methods in which the patient will be receiving their nutrient include intermittent bolus feeding. This means that the person is placed on a schedule and they are fed at a set time, and the food is given at once. For intermittent gravity feeding, this is when you use gravity in order to instill the feed in the person. So the higher up you hang the bag, the quicker the feed will be administered to the patient. So if you want to slow down the rate, then all you have to do is lower the bag. Continuous infusion is when the patient is placed on a pump. So basically the pump will be administering set amounts of feed throughout the day. This is usually done when the patient cannot tolerate like an intermittent bolus feed because it is too much for them to handle all at once. Cyclic feeding, this is similar to continuous infusion, but it's only done over a shorter period of time. Keep in mind, whenever a patient is on any type of feed, they should never be in the supine position. Again, when patients are on any type of enteral feed, they should not be in a supine position. Why? They run the risk of aspiration. So they should at least be at a semi-Fowler if they cannot tolerate sitting in a high Fowler or a Fowler position. So remember, at least at 30 to 45 degrees angle, they should be sitting up, or they run the risk for aspiration and developing other complications. Think about it. When you eat, can you eat in a supine position? No, you cannot. So why would you want a patient to be in the supine position? So you have to think about it logically also. So what are some nursing care that should be kept in mind when patients are being placed on enteral feed? So the first thing is definitely patient education and preparation. You have to make sure or ensure that the patient is well educated on the procedure that they're about to have, what the treatment modality will be, and how they can best manage, their situation situation that they're going through, because this can be traumatizing for some patients. So you definitely want to educate the patient and prepare them for what's to come. So let's move on to tube insertion. So the tubes are inserted in different ways depending on the feeding modality. If it is a nasogastric tube, it will be inserted through the nose. If it's a gastrostomy, it will be inserted from the abdomen. So that will be the entry site. You definitely want to make sure after you have inserted a nasogastric tube that you check for placement. So the only way to check for placement is to do a chest x-ray. Instilling air while auscultating the abdomen is not a correct practice. So again, the only way to check for correct placement is via chest x-ray. Clearing tube obstruction. With enteral feed, the tubes may become obstructed, but the first thing is to prevent the obstruction. So you definitely want to make sure you always flush before, during, and after any medication administration. Do not mix medications. Make sure that if you're gonna crush any tablets, make sure first it is crushable and then it is crushed properly. So you definitely want to make sure you implement these procedures in order to prevent obstruction. However, if it does happen, you can do a light irrigation with a 30 ml syringe or higher. Now we don't want to use a smaller barrel syringe because it will exert too much pressure and it can cause damage to the tube and to the patient. So you definitely want to do a mild irrigation. If it's not being dislodged, if the obstruction is not being dislodged, then you may want to replace the tube in total. You definitely want to maintain tube function. Make sure you're using the tube correctly. As I said, make sure that the medication is crushable. Do not mix medication. If the medication may be obtained in a liquid form, then definitely advocate for the patient, because we are advocates for the patient, correct? So definitely advocate for the patient if the medication may be can be obtained in a liquid form. We definitely want to monitor, prevent, and manage any complications. So a complication may include aspiration. We know how to prevent aspiration, correct? And which way can we prevent aspiration while someone is on enteral feed? If you said do not place them supine, place them at least at 30 to 45 degrees angle, you are correct. And tube removal. If the patient no longer needs the tube, then what's the use? So you're going to remove the tube. What's the procedure for measuring the nasogastric tube? Have to know what length to work with, correct? So first you need to measure the tube from the nostril to the tragus, from the tragus down to the xiphoid process. Alright, again, so from the nose to the tragus, from the tragus to the xiphoid process, and this will give you an approximation of how much tubing that needs to be inserted into the patient. So don't get confused now. You don't want to bring the tubing from the nostril down to the xiphoid process. Think about it. The tube will be inserted at an angle. It has to go back to the pharynx first and then goes down the esophagus. So you definitely want to make sure from the nostril to the tragus to the xiphoid process. Once you have successfully inserted the tube, you definitely want to secure the tubing and mark where the tubing was inserted, or the point of exit of the tube from the nose. Alright, what that means is that you're going to first secure the tubing, of course, so you may use a tape and secure it to the nose, and you also want to make a mark on where the tubing exit. This serves to identify whether the tube has been dislodged from the area that it was left in. If it is dislodged, it can cause problems, such as aspiration pneumonia. If it came out of the esophagus, out of the stomach, and went into the lungs, then they're gonna have a lot of complications. So you definitely want to make sure that you check for tube placement where the mark is before every feed. So before and after every feed, you definitely want to check the marking on the tube. Again, for enteral feed, if the patient is on a infusion pump, then you definitely want to monitor for any kinks. Make sure that the feed is not running out. If the feeding is getting low, then you have to start preparing for the next one. Also, if they are on an infusion pump, wouldn't they have to be at a 30 to 45 degrees angle all the time? Yes. Assessments that need to be continuous and ongoing when a person is on enteral feed. You definitely want to check tube placement. Always be aware of tube placement. Patient's ability to tolerate the feed. If they are not tolerating the feed, they can have nausea, vomiting, diarrhea, so you definitely assess for this. Look out for signs of dehydration. Because this feed is concentrated, they may run the risk of dehydration. Also, look out for increased glucose level. So even if the person is not diabetic, you definitely want to do a finger stick on this patient to see if their serum glucose level is out of range for the feed, because again, this is a concentrated feed or a formula, so you definitely want to make sure that the patient is maintaining homeostasis with their glucose level. Also, you need to check for gastric residual, meaning that how well is the stomach emptying once this feed is instilled. If you are going to do intermittent feed, you definitely want to check the residual before you initiate the feeding. Definitely pay attention to their intake and output. Make sure they do their weekly weights. Are they gaining weight? Are they losing weight? Are they maintaining adequate nutrition for proper body function? So definitely pay attention to their intake and output. So some problems that can arise when a person is on enteral feed. So again, the diarrhea. This can occur if the feed is instilled too quickly or the feed is too concentrated. So you definitely want to pay attention to this and have it modified in order to suit that patient. Nausea and vomiting. Again, it can occur if the feed is administered too quickly. Gas, bloating, and cramping. With gas, bloating, and cramping, you do not want to administer cold feed to the patient. Again, you do not want to administer any cold feed to the patient. While the cold feed is irritating to the stomach, it can cause severe cramps and pain, and it might be a very bad experience for the patient. So do you want this feed at room temperature or warm? The answer is yes. So again, do not administer cold feed to the patient. Dumping syndrome again can occur if you instill the feed too quickly or if it's too concentrated. Also, a quick tip in order to help prevent dumping syndrome is laying the patient on their left side. So left, leave it in. Again, left, leave it in. So basically leaving it in the stomach for a longer period. Aspiration pneumonia, definitely want to look out for that. Again, you never want to put the patient supine, and you want to make sure that the tube placement is correct. Always check for tube placement. I am stressing this, guys. Always check for tube placement. And again, hyperglycemia. Again, the feed is very concentrated. You definitely want to check for hyperglycemia, and the patient might need a temporary insulin correction dose. So again, even if they're not diabetic, they might need some insulin. So you definitely want to explain to the patient what's going on, why they need the insulin, and what their glucose is. So you definitely want to make sure that the patient knows what's going on. Azotemia, this is a buildup of toxic waste in the body, so you definitely want to pay attention to the patient's lab values and make sure that everything is in sync or in the normal reference range. So in order to maintain normal bowel elimination, you need to keep a few things in mind. So first, you definitely want to pay attention to the selection of the tube feed formula. So you're going to look at the concentration, the osmolality, and the fluid contents of the formula. Prevent contamination of the tube feed. Maintain a closed system. Do not hang for more than 4 hours if it is an open system, because you run the risk of contamination. Definitely assess for diarrhea, constipation, and dumping syndrome. So let's move on to gastrostomy and jejunostomy. So definitely you want to make sure that the patient is knowledgeable about the procedure and about what's going to happen with them having this feed in place or this tube in place. Definitely promote self-care because they can have disturbed body image, so you definitely want to promote self-care. Make sure that they are vocalizing what exactly they are feeling in the time. Maintaining skin integrity, that is very important. Maintaining skin integrity, because that can lead to skin breakdown, introduce infection to the body, and lead to an entire new problem. Nutritional status, of course, you want to make sure that the patient is receiving the adequate amount of nutrition to maintain optimal health, and also inspection of the tube. If the tube is faulty, it's not going to do its job correct. So you definitely want to pay attention to the tubing. If there's a problem, definitely report it right away so the tube can either be replaced, or if the patient can tolerate or go back to regular feeding, they can do that. So in order to help prevent infection at the site of insertion, you want to have a proper dressing in place. Manipulation of the stabilizing disc in order to prevent skin breakdown. So with a gastrostomy, there will be a small disc. So I'll actually tag a picture so you guys can have a better understanding of how it looks and the barrier that needs to be around it in order to prevent skin breakdown. Alright, let's move on to parenteral feed. So parenteral nutrition is intravenous feed in which the patient gets the nutrient directly into the vein. Complex mixture containing protein, carbohydrates, fat, electrolytes, vitamin, trace mineral, and sterile water are administered in a single container. So should this mixture be sterile? Yes, you are administering this high concentrated nutrient via the vein, so you definitely want to make sure that this is a sterile mixture. The goal for this is that the patient cannot tolerate an enteral feeding, so they have to get it parenterally, and this is to help them to maintain optimal nutrition. What are some indications for initiating parenteral feed? So the patient is unable to tolerate enteral feed, patient is not interested or is unwilling in ingesting proper adequate nutrition. So for a person who is experiencing anorexia, this might be the only other best option for them to continue or to get back to an optimal state. Underlying medical conditions which will not allow them to intake anything orally, or simply this person need to be on bowel rest. If they need to be on bowel rest, they need to get the nutrition some other way, right? So they need to be getting it parenterally. So some other signs that you need to look out for in order to know if parenteral nutrition is best for that patient. You definitely want to check their nutritional status. If they are having a decreased oral intake for greater than 1 week, if they have weight loss more than 10%, if they have muscle wasting, you definitely want to initiate a parenteral feed. Okay, some problems that may develop with parenteral feed. They may develop pneumothorax or air embolism. This is when air enters the chest and causes the lungs to collapse. So you definitely want to look out for this. Clotted or displaced catheter. Again, you definitely want to make sure that the tube is flushed on a regular basis in order to prevent clogs. If infection gets into the vascular system, then it can lead to sepsis. So you definitely want to make sure that this is carried out sterilely. Again, this will be a sterile procedure once the patient is on a parenteral feed. Hyperglycemia. With hyperglycemia, because the nutrient is being administered directly to the vein, the body did not have enough time to signal the pancreas to release insulin. So with this, you definitely want to monitor their blood glucose level, and again, they may need temporary insulin. Now, pay attention to this. If a person is on parenteral feeding, you never want to stop the feed abruptly. Again, never stop the feed abruptly, because this can cause rebound hypoglycemia. So you definitely want to taper off. Again, taper off of parenteral feed. The person can also experience fluid volume overload or fluid volume deficit. So you definitely want to monitor their fluid volume, their fluid status throughout their feed, and make sure that it is adequate for them. So again, to maintain optimal nutrition, or to see if the patient is maintaining optimal nutrition, you definitely want to do daily weight the same time every day, preferably in the morning without clothes on. Right? Accurate intake and output. You definitely want to monitor this to see if whatever they're putting in is what they're getting out. So prevention of infection, you definitely want to do appropriate catheter care. Again, this will be a sterile procedure. So the technique, the dressing change, administering food is going to be a sterile procedure. Always wear a mask when changing the dressing, because you don't want any particles to fly from your mouth and onto the side, because this can cause microorganisms being introduced to the area. Assess insertion site. So you're going to look out for warmth, redness, any irritation of the area. That could be a first sign of infection, so definitely look out for these. So with a person who is receiving parenteral feed, they can also be placed on an infusion pump. With infusion pump, you definitely want to make sure that adequate feed is available for the pump to administer. Now, if the feed has run out, you want to hang something that will maintain the person's blood glucose level, because it's so concentrated, and if it is stopped abruptly, it can cause rebound hypoglycemia. So what would you do in a case if the feed runs out? If you said hang 10% dextrose, then you are correct. So hanging 10% dextrose will help to maintain this person's blood glucose level. Now you may say, oh, I might want to add or hang normal saline while I get the feed prepared. No, normal saline does not have glucose in it. The person, although their fluid or their hydration may be kept at a normal, in the normal range, their blood glucose level will drop because the normal saline does not have glucose. Also, one final tip before I go: if a person is on parenteral nutrition, do not, I repeat, do not administer medication in that line. That line was not meant for medication, it is meant for the feed. So again, if they are on parenteral nutrition and they have medication via the IV route, they probably need another IV access. So never administer medication in the enteral feed, or mix it. So with that said, guys, thank you for watching this video. Make sure you like, comment, subscribe. If you have any questions at all, make sure to leave a comment or send me an email. Once again, thank you for watching. All the best and good luck.